practicalities about how we're going to try to get this done, or start to get this done, or indeed actually have already commenced getting it done. So firstly, I must reiterate that the vaccine, as said before, is not a substitute to all the requirements and government guidance around social distancing, etc., etc. So please bear in mind, even if you are vaccinated, it doesn't suddenly give you a Superman type shield that means you're allowed to go out there and flaunt government guidelines. It's not intended to be that way. So how are we going to do it? So I suppose I'll start by saying what sort of centres are we going to be doing this at. So we've got, largely speaking, 3 centres. They're the hospital vaccination sites, PCN hubs, and PCNs are primary care networks, which I can talk about shortly. I've got to remember to stick to my 5 minutes. And then followed on by mass vaccination centres. Now, locally, we've started 2 out of the 3. So we've had hospital hubs. So at the hospital site across Ipswich and Essex and Suffolk Foundation Trust, they've delivered almost 8,000 doses of the vaccine, having started their process at the start of December. And they've been vaccinating a cohort of people, including care workers, at-risk frontline NHS workers, and the over 80s patients, inpatients and outpatients. But that's very soon going to move over to be the responsibility of primary care networks. Now, some of you may know, some of you may not, but over the last year or so, general practices have been coming together to work as primary care networks to work more collectively to try and share workforce and try and share delivery of certain things. And actually, that provides a fantastic opportunity for something like delivery of the COVID vaccine. Now, one thing worth bearing in mind is that this is a massive logistic challenge. As Juno said already, storage of the vaccine is a challenge, but it's not just the storage. It's once you thaw it out, they're coming in batches of 975. Once they're thawed out, you've got to use them up in 5 days. Once they're out of the fridge, you've got about 6 hours. And each vial comes as old-fashioned vials where you have to draw up the vaccine independently, and there's 5 doses per vial. So somebody has to sit there and manually draw up 5 doses from each vial to then deliver the vaccine into the muscle. So it's by no means an easy challenge of hit and go. And so it means lots and lots of logistical planning. Not to bear in mind, as I said, we've still got to bear in mind the social distancing. And we've got to make sure that after you've had the vaccine, there's a period of observation for 15 minutes. So massive challenges. But the amazing thing is how everyone, and I mean everyone, not just NHS, healthcare, voluntary services, people in the local community, have come together to bring this all for our patients, for our public, so that we can start to vaccinate everyone, so people can start to develop this immune response, and so we can start to get our lives back to normality. So where did we do this first? So the first place we did it was last week. We started in Clacton, and this was at the Tendring Centre, previously used by St Helena Hospice. And so this is where St Helena Hospice, staff from East Lynn and other community partners came together to deliver the vaccine programme in Clacton, where they had to do everything that I just said, get a bunch of vaccines, 975 doses, and deliver it to members of the public in the over 80s range. Now that's been a success. We did that last week. And now we're about to do exactly the same thing here in Colchester, starting tomorrow. So we'll start the same process again, where we've got 975 vaccines. And we're going to be using the same processes where we'll be administering the vaccine using a combination of volunteers from practices and again from the local community. As Juno has said, we've got lists that we've submitted of all our over 80s patients so that we can start to invite these people. Please don't contact your practice to ask when you'll have your jab. We are proactively contacting people and we're working at the minute on the basis of area with the hope to expand it as more and more vaccine comes down the line. Now, these are the 2 sites that we've got in Northeast Essex. I gather there's around 20 in total across Suffolk and Northeast Essex that we'll be rolling out. So over the period of the next few weeks, as we get more and more familiar with how this works, as staff get more familiar, as we start to understand the processes, we can get slicker and get better at delivering this. But the important thing is that everyone is working together to get this done, and you will be called when it is time for you to get your vaccine.
Just a couple of things of note. Very important message that if you haven't heard yet, it takes time to get through all those people in that first priority. So just you're asking people to be patient. They may not be contacted until mid or even later in January. And the other thing I think is probably important to say is that every person that receives the vaccine has to remain in situ for 15 minutes whilst they're being observed before they're allowed to go home, aren't they?
Indeed, that's the guidance at the moment, and so you need to plan for that if you're coming to the centre. I suppose one last thing, if I could mention, is probably just DNAs. So as Juno said, if you don't want the vaccine and you've been invited, please let us know as early as possible that you don't want that, so we can make arrangements for it. Because actually, there have been a small proportion, but still some people that haven't attended for the vaccine. And when you've got to go through this whole process to draw up the vaccine and get it, the last thing we want to do is be in a position where we're wasting valuable vaccine.